Welcome and thanks for joining us. My guest today is Rick Bryant. He's the Healthcare Chief Technology Officer at Veritas. Rick, good to have you with us.
Thanks for having me, Tom.
Let's begin with the big question, and it's a hard question to maybe containerize, but maybe you could capsulize for us, if you can, just exactly what effects the pandemic has really had on the healthcare system, especially as you get past the crisis stage and the crowded hospitals. But what's the steady state going to be like now?
The steady state has changed so much over the past 2 years, and I really have to hand it to our healthcare heroes because they really stepped up. They're defined as critical infrastructure, and they really were pivotal in being able to maintain and manage under this pandemic. At first, when they shut down discretionary services, that put a lot of burden, right? There's a lot of revenue around discretionary services. So we've had to have some makeup on that this year. Also, initially, when the pandemic broke out, they were very concerned about surge capacity. And it was interesting because even though healthcare has been very reluctant to embrace the cloud because of security concerns or control concerns, if you will, they found that traditional procurement methods just don't work. It takes over 2 months to get a server, but they need those stand-up clinics and testing facilities right now. So they started embracing much more of the cloud. Similarly, they had to do a lot of work from home, and telehealth became on the forefront. I've been really pushing for telehealth for over 10 years, but I've seen more advancement in that over the past 2 years than the past 10. Now, the challenge with that is that there's no way to ensure that they're going to get funded and reimbursed for telehealth after the pandemic. And I think that's become a major way of being able to have continuity of care. We're looking forward to some legislation to enable telehealth and telehealth support services going on beyond, but that's going to require some legislation.
Sure. And then the ancillary issue, which is also kind of a crisis, is the rise in ransomware, which seems
Oh,
to coincide with the arrival of the pandemic. And this has hit specifically healthcare organizations, both large and small. And what is the best practice for dealing with that, would you say?
I can't have a conversation with the CIO today without talking about ransomware. Um, Public sector specifically being targeted. And it's kind of ironic because I've been warning the industry about ransomware since early 2010s because I saw a correlation of very high value data and a relative low investment in security. Well, now that those ransomware have turned into a huge profit generating event, they're specifically targeting healthcare. And so we see healthcare as having to embrace a lot of new changes in the way that they protect their environment, and more importantly, how quickly they can recover from these events. We built our technology with a zero trust architecture from the beginning, which enables them to at least be able to recover, right? Once their data is backed up, we can protect that backup and enable them to recover. We've since then added a lot of immutability capabilities, and we've been working a lot with the requirements with both cybersecurity insurance companies and the federal government to best protect our environment here.
Yes, because the idea of backup and recovery is really crucial in this, especially the recovery. And you can't do that unless you back it up correctly. And this is a case in ransomware where encryption is really not the answer in and of itself, though, is it?
Right, right. So even if they have the ability to recover, the speed of recovery is starting to come to forefront, right? I've worked with some major healthcare institutions and they did the math and they said, if I were to have what I call a smoking hole scenario, my entire environment taken down, it would take them over 33 days just to recover. So they're starting to look at what we're calling cyber resiliency. And luckily Veritas is well positioned for that because we take data protection to actual predictable recovery with our resiliency platform, which you're entitled to with that. So not only can you have a backup that's protected, you can have an SLA and push button restore at scale. And so a lot of our customers are really embracing both immutable capabilities and our orchestration capabilities as well.
And when you look at all of these topics we've been talking about, the ransomware issue and dealing with speed of recovery and making sure that you have really well done backup, and also the adoption of cloud. It really all has in common a need for looking at the healthcare IT infrastructure, doesn't it? That's really the common thread in all of this. And what are the big infrastructure trends you're seeing then that underlie
Well,
all of these other initiatives?
Well, like I had mentioned, cloud embrace, right? So we came up with the technology early 2018, which we were going to unveil at HIMSS, which is the big healthcare conference, where we can actually do recovery on demand to the cloud of your choice. We demonstrated this with an Epic platform where literally you push a button because you need extra capacity or because you need to fail over. You operate it at the cloud for the time period that you need. And then after the event's over, you can push another button to not only bring that workload back on premise, but to tear down all the residual costs and infrastructure within the cloud. So we're starting to see a lot more movement towards that. We're starting to see a lot more movement towards sustainable telehealth practices and true DR testing and capabilities.
Got it. And so, what does this all do to cost? What is the cost factor here? Because even large national healthcare chains and the big providers, they operate under, as we mentioned earlier, pretty strict cost constraints, especially when getting reimbursed by federal programs.
Yeah, well, it's interesting. We see the effect of the pandemic having cost impact in different areas. Areas with a lot of surge in COVID are being reimbursed very well by the federal government, but all the other hospitals that had to shut down those discretionary services lost that revenue and lost it permanently. So what we've been able to do is to take this board level initiative. We have several customers that have 7, 10, $50 million approved at a board level to make sure that they're ransomware resilient. They don't want to end up in the news, but to take that and make it into a true cyber resiliency, which not only protects them from ransomware of today, but it protects them from the next bad guys that are coming out there. And if they do it right by applying IT analytics, that is also part of our portfolio, we can pay for that project by reduction in processing and storage by right sizing those environments. So it's really improving the maturity of the healthcare system.
And I suppose having a cloud-based infrastructure, as well as maybe a data center backup in the hybrid role that many large organizations are establishing, that really gives you resiliency, say, in a power failure or in a cyber attack that tries to interrupt service. You've got this containerized, if you will, workload with the data safe, and it can be portable to where you need it to keep going. Fair?
Yeah, absolutely. And we work with customers from the very largest that have a huge cloud presence and actually multi-cloud failover capabilities, which is extremely challenging. But by providing a single pane of glass, you make that manageable. But I think the biggest value proposition around the cloud is just now being embraced. And that's where you have these regional hospitals, the ones that really do the work to protect the community. They may not have an out of region data center. Well, guess what? The cloud is a perfect way to provide them with some regional diversity and some resiliency.
And I wanted to just touch on a question you mentioned earlier, and that is the question that hangs over continued payment by federal agencies and therefore other providers that kind of follow in lockstep for telehealth types of visits. I would think that data analysis and the ability to really mine what it is you're doing to show efficacy of results will be an important part of being able to convince payers and in turn convince Congress that this is something that the federal government should reimburse healthcare providers for.
I really do believe that. And I have to say, I'm biased. I was an advocate for that before. I think it's a great way to reach underserved populations. They may not be able to get to the doctor's office, but they can turn on their webcam on their laptop. Also, to be able to harness that event. And this is one area where I really believe that we're ahead of the trend. Whereas we took our classification engine, our Enterprise Vault classification engine, and we said, hey, look, we're using this technology to harness all the information that comes from the financial services industry or the telco industries. And they've been able to embrace that. Well, I went out and proactively worked with our product development and got them to bring in this type of AV as a data source. So using an existing 15-year-old proven technology to be able to apply it to this new goal. And the benefit of being able to provide this is you're able to provide supervision and quality assurances, right? You want to make sure that the patient has a good experience with this so that they don't go to another provider. And to that point, with telehealth being enabled under the Stafford Act, you now have a choice like you never had before. I used to go to a doctor that's around the corner because it's convenient to me. Now I can go to the specialist in New York City if I want to.
So in many ways, you might say the pandemic has had a silver lining in terms of the long-term prospects for healthcare and being able to give it to people where they want it and when they want it.
I'd be reticent to call the pandemic a silver lining because of the stress and the burnout it's taken, but it has forwarded the technology and the maturity of the industry for sure. And I think this is important, right? Because I can't think of a single disaster critical incident where healthcare is not going to be a primary concern. So by them becoming more resilient, by them becoming more flexible, it's going to make us a much stronger society.
Good note to end on. I want to thank today's guest, Rick Bryant, Healthcare Chief Technical Officer at Veritas. Good to have you with us.
Thank you so much, Tom.
I'm Tom Temin. You're listening to WTOP News. For more on this discussion, please visit WTOP.com and search Veritas.